talk now about target selection. It is partly my personal bias, but based on my reading of the current literature, that things we want to consider include this. We want to facilitate rapid success. Again, thinking about level of challenge so the child has some success, but also some challenge. We want to increase the effectiveness of the child's verbal communication as rapidly as possible, again, as a motivator, so that once they see the success, they want to build on it. I want to choose targets that will allow quick generalization so that we're moving as quickly from our drill and practice to using those targets in the real world. I want to use what the child gives me in terms of having sounds and syllable shapes that we can build on to develop a core functional vocabulary. I don't spend a lot of time worrying about whether the child has the developmental sounds in the progression that we typically think about. If that child can produce an S in their spontaneous output or in practice with me, I'm going to use that S even if they're very young, because that is a sound that contributes significantly to intelligibility. So I'm aware as I'm choosing targets and thinking about next sounds to address of which ones are considered later developing or more challenging, but I'm not going to limit myself and say that a child with apraxia should not be working on those later developing sounds if they're stimulable for them. And then finally, in our target selection, I'm thinking about how do I improve that child's ability to produce movement gestures so they can accurately produce specific vowels and or consonants. So we talk about working at a level of movement versus sounds, but I may be incorporating specific target sounds, specific phonemes in my core set that I see the child needing practice, but I may place them in different contexts than what you would typically do in sound-based therapy.